Hello everyone, and welcome back to our channel. Today, we're tackling a really important and common question. If you're taking antidepressants and starting to feel better, how long should you continue the medication to prevent a relapse? We have a multiple-choice question to guide our discussion, so let's dive in. The question is, to prevent the recurrence of depression, how long should a patient take antidepressant drugs? Is it A, 6 months to 2 years, B, 2 months to 1 year, C, 1 year to 3 years, or D, 1 to 3 months? This is a critical topic because stopping medication too early is a common reason for depression to return. So, what do the clinical guidelines say? For most adults who have recovered from a depressive episode, the standard recommendation is to continue taking the antidepressant for at least 6 months after achieving remission. Remission means your symptoms have significantly reduced or disappeared. This continuation phase is crucial for solidifying your recovery and minimizing the risk of relapse. So, right away, we can see that options B and D, which suggest shorter durations, are likely incorrect. Now, let's look at specific situations. For older adults, guidelines often suggest a longer period, typically a minimum of 12 months of continuation therapy. This is because the risk of relapse can be higher in this age group. What if someone has a history of recurrent depression, meaning they've had multiple episodes in the past? Or what if there are other factors that put them at a high risk for relapse? In these cases, doctors usually recommend continuing treatment for at least 2 years, and sometimes even longer. This is often called maintenance therapy. So, when we look back at our choices, we see that a range of 6 months to 2 years covers the most common scenarios. It includes the standard 6-month continuation phase for a first episode and extends to the 2-year maintenance period for those with a higher risk of recurrence. Therefore, the best answer to our question is A, 6 months to 2 years. It's extremely important to remember that this is general guidance. The decision to continue, taper, or stop medication is a very personal one and should always be made in collaboration with your doctor. They will consider your specific history, any lingering symptoms, and your overall health. Never, ever stop taking your medication abruptly or without medical supervision, as this can cause withdrawal symptoms and increase your risk of relapse. Making these decisions with your healthcare provider ensures the safest and most effective path for your long-term mental well-being. Thank you so much for joining me today to discuss this vital topic. If you found this information helpful, please give this video a thumbs up and subscribe to our channel for more evidence-based content. Stay safe, stay informed, and we'll see you in the next video.